Okay, great, thank you. And thank you for the opportunity to present these results at this forum. I think it's very important to be able to bring together this important research on immigrants' health and safety. So I'm going to be presenting results from a study on access to workers' compensation for workers with limited English proficiency. So just to give a little bit of background, in Ontario, a little more than a quarter of the population speaks a non-official language as their mother tongue. And in Toronto, that proportion is actually much higher. It's 43%. This linguistic diversity is expected to rise actually over the next decades, in large part because of immigration patterns. And our research focuses on an important subset of this population, which is basically individuals who lack verbal or written proficiency in English. And in the context of this research, we refer to them as linguistic minorities. So research from Canada and the United States has shown that linguistic minorities are overrepresented in risky jobs and experience elevated rates of occupational injuries, illnesses, and deaths. And the research has also shown that they have inferior experiences and outcomes with regards to workers' compensation and also with regards to return to work. So in the context of this project, we asked ourselves, well, what are some of the reasons for these inferior experiences and outcomes? And we sought to do this in the context of a comparative analysis between two provinces with very different approaches, which is Ontario and Quebec. Just to give a little bit of context, so in Ontario, there is no requirement in law or policy to provide services in languages other than English, with the exception of French. However, the WSIB does provide services in multiple languages, namely through the use of interpreters and translators. And also recently, it put in place a specialized team of work transition specialists to assist linguistic minorities specifically. So while there remain opportunities for improvement, there is a recognition that the one-size-fits-all approach does not work. Comparatively, in Quebec, there are no such language accommodations. So, for example, the Workers' Compensation Board in Quebec does not provide interpreters or translators. That's the workers' responsibility. And there are many finer policy differences between the two jurisdictions. And we're actually in the process of conducting this comparative analysis. But today, I want to focus on our preliminary Ontario results. So in Ontario, so far, we have conducted interviews with 9 linguistic minority workers. These were workers who had a work injury or illness, and workers with or without claims. And we're actually continuing recruitment and interviews for these workers. And we also conducted interviews with 20 key informants. We did this because it's important to have the different perspectives of workers and key informants. Often the workers will provide us with their lived experience, whereas the key informants will give us an idea of the general trends and the broader trends that we're interested in. So we recruited workers through community organizations, social media, online ads, as well as non-English community newspapers with the help of flyers that we translated in a number of different languages. And we recruited key informants through our contacts as well as through snowball sampling. And so the interviews were recorded, transcribed, coded, and analyzed with NVivo software, which is qualitative analysis software. And as I mentioned, this analysis is ongoing. So today I'm going to be reporting on results from interviews with 8 workers and 17 key informants. So the demographic characteristics of our key informants, well, essentially they included community legal workers, health professionals, representatives from the Office of Employer Advisor, and also the WSIB. In terms of the demographic characteristics of the workers that we spoke to, mostly they were primarily older workers, so the majority were in the 49 to 65 age group. So we had skilled immigrants and also from other immigration categories. What's also important to note is that most of them had a university level education and that most of them were long-term immigrants. So that important to remember that language is not a recent immigrant issue, that it also, language barriers are also an issue for individuals who have been here for, in some cases, many decades. 7 out of the 8 participants had filed a claim. And most of these workers were involved in factory work. And also in terms of the language proficiency, we had a range of English language proficiency. So some of the interviews were conducted with the help of interpreters, and others weren't, as an example of the range of language barriers that we came across. So this is not a random sample, so it's not necessarily representative of the range of experiences that are possible. So for example, the fact that we have a lot of university-educated participants means that we are not including the perspectives of participants who don't have this high level of education. So, so that's important to keep in mind. Now, in terms of our results, so the first thing that I want to mention is the accident context. And it's really a situation where there are many different layers of risks. First of all, linguistic minority workers tend to work because of the language barriers in manual jobs, and also jobs that tend to be very demanding. So we saw a lot of fast-paced, heavy lifting, high-demand jobs, some jobs where the targets were very difficult. In terms of the psychosocial work environment, some were in exploitative situations, but we also spoke to workers who had positive relationships with their supervisors. Most were involved in some type of precarious work, so work through temporary agency was very common. And even those who were full-time permanent workers tended to work on shift work and didn't have benefits. And for some of them, they actually had been in these jobs for very long periods of time. So it wasn't unusual for workers to find a job and to stay there because, and part of the reason for that was because their employment opportunities were limited. It's also a context of, and this is echoing Iggy and Bashak's presentation, of inadequate health and safety measures, lack of training on occupational health and safety, and also overqualification, since most of our worker participants were university educated, and we know that overqualification is actually associated with a higher risk of injury. So the majority of the workers in our study suffered long-term injuries related to mostly repetitive strain injuries and those related to trips and falls, and some had permanent impairment as a result. Now, the first thing that we found was that there were issues with the reporting of these occupational injuries and illnesses, and primarily that workers delayed reporting for a range of different factors. And this was really a combination of factors that related to language barriers, but also fear. So for example, fear of losing their job, lack of knowledge about their rights, financial precarity. Cash work was another obstacle for some because of the burden of proof of having to prove the employment relationship. And in some cases, reporting was made more difficult because of employers who discouraged reporting, either by threatening employment or in some cases exploiting the workers' lack of English proficiency and filling out forms in a way that would disallow the claim. So this is a quotation from one worker who said, "I'm scared they fire because during that time, I think it's around Thursday, because everybody have their 2 days off. So I think maybe Friday, Saturday, Sunday, 3 days maybe I can recover. It got a little bit better, so I didn't tell the supervisor I got injured." And this was actually very common, and it speaks to the delays in reporting and eventually the issues that occur down the line because of these delays in reporting that often can result in more severe injuries or illnesses and also in administrative hurdles down the line. In terms of healthcare, we really found two different types of problems. The first one was with workers having difficulties finding doctors who speak their language, and especially specialists who speak their language, which also could cause delays in some cases. When workers interacted with doctors who didn't speak their language, there were communication barriers, even when interpreters were present, which wasn't always the case. And the main problem was that workers were unable to describe their injuries and sometimes their work in a detailed way. This is a quotation from a community legal worker who said, "There is a legitimacy that you get by being able to describe your injury in a medically objective manner that linguistic minorities may not have." So that's one thing. For example, a worker who describes the injury as, "I have pain in my hand, and I'm pointing to my hand right now, and you can see that it's my hand here. Meanwhile, I speak another language, and there are so many words of this part, and it's not a direct translation. So how am I to describe to you where my pain is? But if my answer is where the legitimacy of my claim is coming from, then I'm at a loss." This had implications for creating delays, but also misdiagnosis and also potentially impacting the outcome of the claim. In terms of communication, it's important to note that it's not just language, but that culture also can play a role. Specifically in terms of particular health problems, whether it's mental health problems, in some cases it could be amputations, and that created added difficulties for members of certain communities. So in terms of the workers' compensation process, I'm going to speak generally about the workers' compensation process and what are the circumstances that led to added difficulties, and then focus a little bit on return to work more specifically. So the first issue that came up was the difficulties in filling out forms. That was more difficult because of language barriers. So forms are only available in English and French and can only be filled in English and French. And so as a result of that, the workers often needed assistance and sometimes had difficulties finding the assistance, the support that they needed to fill out their forms. A related issue, and this is not unique to the WSIB, this is the case for a lot of for workers' compensation systems in general, is that the workers' compensation language and process are complex even for English speakers. And people described, one participant described the process being like a maze and trying to navigate it. And the language is also different. So if English is a second language for these individuals, the workers' compensation language becomes a third language, and also the medical terminology becomes a fourth language. So they're having to master these different languages, if you will, in trying to navigate the system. And as a result of the complexity, in some cases, some individuals give up and quit. So we came across that as well. Another dimension of this is that the process requires the workers' input or self-advocacy in a way that can be difficult for linguistic minorities. So one example is that we came across was an employer who provided a job description that didn't reflect the reality as was experienced by the worker. And the worker said, and then the worker had to challenge the description provided by the employer and said, it's just their word and my word. And this is difficult in the context of language barriers when you think that this is basically your word versus my word. And as a result of that, this has implications for the WSIB, who may not be able then to get the full picture of what's happening, and then it has implications for accommodations down the road. Another point was that support in the form of face-to-face, continuous, and lengthy interactions was not always possible. So communication on the phone is more difficult in the context of language barriers. Sometimes body language is important in that context. Continuous interactions are also important, so dealing with the same person, so getting consistent information. And lengthy interactions, so that taking enough time, for example, to communicate information is also important. So, for example, there was an example could be a case manager who might not have enough time and might ask the worker, did you understand? And the worker says yes without having really understood, and then rushing through the process. And this is part of this initiative now to have this dedicated team of return to work specialists that the WSIB has put in place to address some of these problems, so that they actually take favor face-to-face interactions. They will have this continuous interaction and will take more time to explain decisions and to have conversations with workers. Now, translation and interpretation services, we should not underestimate the importance of these services. They're extremely important in what we see actually in our comparative analysis with Quebec is the immense difficulties that workers face because they don't have access to interpreters and translators, so they have to find their own, and this causes all sorts of difficulties. So the translation and interpretation services that are in place really play an important role, although we did find that there were some issues that remained with regards to needs identification. So, for example, identifying the need for an interpreter or a translator early on. And also, in some cases, workers had a good command of spoken English, but had difficulties in writing and reading English. And perhaps this wasn't identified because the spoken English was so good. Timeliness, it does take time to translate documents back and forth, and this could cause delays. So there is an issue with delays and the translation of material. There can also be issues with the quality of interpretation. So based on the interpreters, some will have WSIB experience and will be familiar with the terminology, and some will not. So that can be an issue. And consistency is that in some cases, there are some cases where interpreters are used consistently throughout the process, and some cases where that's not necessarily the case. WSIB staff can ask for interpreters and translators. However, workers do not have the ability to request an interpreter, and they might need this interpreter for their interactions with the WSIB, or also medical professionals and other individuals. So in relation to return to work, and I'll go quickly over this because I realize that I'm already at my time limit. So in the main issue that we found in terms of return to work with the injury employer is that the employers sometimes fail to understand the injury or illness or to provide adequate work accommodations. So one worker said, and this was actually complicated in some cases because of the language barriers. So this worker said, okay, so I talked to the supervisor, I only speak a few simple words, but what the supervisor said I don't understand, it was a lot. When I asked my kids to ask the supervisor about my light duty and send a doctor's note to the supervisor, But now the supervisor didn't agree. The third day, it's back to normal. My hands are all swollen. I asked him, so did you give me a light duty? If you don't give me a light duty, I have to go home. And they said, okay, you can go home. So this is an example of the difficulties of the worker having to negotiate for their work accommodations. In terms of return to work with a new employer, I'll just go through this quickly, and because these are also preliminary points that we've identified. That formal evaluations are not always possible, for example, because the workers can't complete the tests, and that requires more flexibility in the assessment of the workers' abilities. Training was not always available, or sometimes not always accepted by the workers, or also sometimes not effective. And so I'll just leave it at that. Suitable work, the identification of suitable work sometimes underestimated barriers to employment, or lack the benefits of the workers' input because of the language barriers. Difficulties with job searching because of a combination of factors: lack of experience in a new field, physical and language limitations, and the stigma of being an injured worker. And another important point is that supportive and mental health counseling is not always available, or available in the worker's language, especially for mental health counseling, which can be extremely important in relation to return to work. So these are some of these, the preliminary barriers that we found. Now, obviously, there is this new strategy, and we are in the process of looking at this data. And the advantage of this strategy of having this dedicated team of return to work, of work transition specialists, is that it's really a collaborative effort where this team gets together, brainstorms about cases, strategize, and it allows creativity and flexibility that is needed for a lot of these particular cases. There's more emphasis on face-to-face, lengthy interactions to promote this empathy and trust in the interactions. And also recognition that perhaps there needs to be different timelines for these cases. So just wanted to mention that. So quickly, in conclusion, it's clear that language accommodations are necessary, but they're not sufficient to account for the particular needs of linguistic minority injured workers. So there is a need to, if we're just going to focus on language accommodations, yes, we can improve translation and interpretation services, but there are also examples of recommendations that I want to quickly bring up that came up so far in our interviews. One is the need for more community outreach for information on rights, and also more help with the completion of forms, and that this help be available in the community. Also, there's a need to have more information available on the health professionals who offer services in other languages, and to make that information easily accessible. Also more help in the beginning stages to check for understanding earlier in the process, and to provide injured linguistic minority workers with more support. And perhaps to look at this initiative with the work transition specialists, and to see how can we formalize the process in dealing with this population. How can we have some guidelines in how we address these particular difficulties? There's also a need for training of staff in relation to language barriers and culture. So now this is preliminary, and in looking at our comparative analysis between Ontario and Quebec, we're noticing a lot of policy differences. For example, in Quebec, language training is almost never provided, and language barriers are almost never considered in the determination of suitable work or employability. So these are big problems. So there is a recognition in Ontario that we need to take into account the particular needs of this population. So it's important to recognize that that we need this approach, and that one size fits all doesn't necessarily work in this case. Thank you very much. I just want to mention quickly, just to acknowledge, this was funded by the Social Sciences and Humanities Research Council of Canada, and also thank my research assistant, Alex Medley, and Momtaz Begum for their work on this project. Thank you.